Hello friends, today we have with us none other than Dr. Massimo Mangialavori. Massimo needs no introduction, but still I would prefer to give some. Massimo is a leading figure in the world of contemporary homeopathy. He lives and practices in Modena, Italy, and he grew up in Milan. He qualified as doctor in 1984. Massimo is internationally known and respected for his deep knowledge and an inquiring mind that penetrates beneath the surface and searches for the unifying pattern of the whole. For example, when researching materia medica, Mangialavori takes into account all the natural phenomena and synthesizes this with anthropological, physical, psychological, and esoteric points of view. His journey is to fathom the themes of the remedies and let them speak for themselves. He has presented many papers in Italy and abroad, and now he conducts a 3-year postgraduate course for the homeopaths. He has written many books, among them Classical Homeopathy, Methodology and Lectures on Materia Medica, and experiences about the use of spiders in homeopathy, milk remedies, and fungi, etc. are popular. So Massimo, welcome to hpd.com. It's a pleasure to have you with us today. Your work doesn't need any introduction, but what I'm interested in is your journey of becoming Dr. Massimo Mangialavori of today. The first fact that I could gather was that after becoming a doctor, you were more interested in food science specialization, especially you did a lot of research related to fasting. Yesterday also we were discussing and you told me that you still fast twice a year for 7 days. So what led you to this interest in food science, and especially fasting?
It was because I was intrigued by the idea that very seldom in medicine you saw a real interest about the quality of food, first of all, and how food is important for us as human beings, not just in terms of giving us calories, but also in terms of feeding in the largest sense of the meaning, which means not just giving us what we need in terms of calories and in terms of proteins, fats, and so on, but what is the cultural aspect of food, which means something, and also how much we can improve the quality of life of the person, and also treating successfully together with other kind of therapies or just using food, many possible different problems. What was a big issue for me at that time was that usually the advice was, this is the way you have to eat. Dealing with people which were a little bit too fat, or dealing with other people. It was a kind of imposition. This is the right way to do that. If you don't do this, it is a kind of your fault. And I kept saying to me, it's like to say to a depressed person, be happy. If it could be happy, they didn't need to come and see a doctor. So my first interest was how is it possible that this person has difficulties in eating a different way, in following a better diet, in having a better relationship with something that we do this daily. Because when you give advices, doing something for a few weeks, for a few months, has no meaning in our life. We need to eat every day for our lifelong. And then because I had, since the beginning of my studies, a big interest in anthropology and a big interest in the, let's say, spirituality, it was nice to see that in many different cultures the idea of fasting was so interesting, so important, so much related to meditation, to pray, and to have a better contact with yourself, which again I think is an important piece of our healing processes. The issue is that at that time there were no really interesting studies about that, which means that you could see something studied in the universities, in the hospital, about people in bed, sick, with certain kind of problem, that were not eating, while fasting is an art, is a devotion, is something that you decide to do on yourself to make a kind of little path. It has nothing to do with obliging a person not to eat, and mostly when they are sick and into an hospital. So this part which has to do with the choice, which has to do with the proposal, which has to do with something that is not just mechanically speaking a wanting to introduce some calories, I think it was not investigated at all. So my purpose of that was studying this. And again, I don't think that any serious study could be done without being a part of it. It's easy to talk about something like that without making the experience. So I wanted to make that experience, which was also great.
And do you still give dietary advice to your patients? Do you find that it's important to give that kind of nutritional dietary advice to the patients along with the homeopathic treatment now?
Honestly, I think that taking care of this is important for any kind of therapy. It's important if you are a physician. It doesn't matter if you are an homeopath or an allopathic doctor, or a psychotherapist, whatever you want. I insist, I think that this is a big, important piece of our daily life. And so I'm very much interested in that. And I try to do this when I can. Mostly, I try to study in my patients which kind of possible relationships we have with our food attitude, with the pleasure of eating, with the cultural aspects of our diets, and of course with a special kind of food. Think about this seminar, this congress. We are talking about lux. It's a very interesting topic. In the right moment that you recognize how critical is for this patient to eat dairy products, how commonly they aggravate doing this, and how commonly even a good therapeutic interaction with homeopathic remedies works much better without using these dairy products in this treatment. But in this case, milk it's not just a liquid, a white liquid with something inside. When you study these remedies, you know how much difficult is the relationship with the family, the relationship with your mom from the very beginning. So in this case, food. That food is not just a liquid. It's representing something much more complex and sophisticated.
Another thing that probably led you to discovery of homeopathy was your interest in medical anthropology.
Yes.
So, what did you find intriguing about medical anthropology, and that you kept studying from the very early years of your medical practice?
I imagine I should tell you the truth. So at that time, when I went for my very first time in South America, I was studying surgery, cardiac surgery. I was trained by my uncle, who was one of the best cardiac surgeons of Italy at that time, precisely in children's cardiac hospital. And I was completely intrigued in that. Anthropology was another important part of my interest, but I never thought it could have anything to do with my profession. It was a hobby. When I went there, I made some experiences. I'm not talking about this in a moralistic way, nothing at all to do with taking drugs or things like this. But it was a confrontation with a different kind of culture, completely different than ours in Western countries. And I saw patients treated by those shamans with incredible results. And when I say incredible, I mean really something that for a doctor coming from the university, coming from an hospital, coming from a training with my uncle, who was a teacher in university, was just possible to explain. And so, I think that when you see something that is so intriguing, so interesting, so effective, so true, and you don't have explanation, you can do as many doctors sometimes used to do, which means scotomize this reality or feeling obliged to study that. Coming back from that first experience, from that first journey, it was in '83, I met an homeopath. This guy lived before in Bogota, in Colombia, in the center of the town. He was a very rich man, a very well-known homeopath, with amazing results and a lot of clients. There was a kind of earthquake. His clinic was broken in pieces. He took this as a kind of signal from up above, and he decided to close the clinic into this town, and he went close to the jungle to treat poor people for nothing, for charity. His office was full of poor men with serious diseases, and they had no money to pay the doctor, and some very severe case from the town took their four-wheel drive from Bogota to arrive to this place to be treated by him. So I spent a few days with him, and I spoke with him a lot about medicine, and I spoke with him a lot about homeopathy. And I found out that many of the principles of classical homeopathy were so close to what I saw in these tribes of these Indians. And so I said, how interesting that a culture from a completely different kind of continent did exist for some thousands of years, and the same principles were discovered in some way, reported by a German doctor 200 years ago. I have to study this.
Okay. So, what was your initial studies like? Was it love at first sight?
The initial study was that I came back home. So my father already bought a little flat in Rome, where I should have done my specialties as a cardiac surgeon. And I came back home saying, I'm sorry, I will start something completely different. It was an issue for my family. I can tell you that my uncle did not talk to me for 20 years. He was like my father for me. I can tell you it was really, really something very painful. But despite that, I put all my interest in this. So I started to seek for some courses of homeopathy in Italy. Unfortunately, at that time, our few schools were very, very low quality. And so I started to travel up and down in Europe and United States to take some not course, seminars. And that was the beginning.
And then how did you discover Dr. Giovanni Marotta?
Gianni Marotta. We're very well prepared. After my second trip to South America, I came back home pretty depressed because I started to discover something in homeopathy. At that time, there was this clear idea that only a few remedies could really be helpful. That beyond the 30, 40, 50 polycrest, all the other small remedies were not small because they were not new enough. They were small because they were less useful. But I came from a very, very rigid university training, where facts, objectiveness, seeking for what is really working and not, was extremely important. So it was important anyway to have good theories, good hypotheses of work, but you have to demonstrate that. So my reality was that in that moment, in the first years of my studies, I had amazing results with certain small remedies that, according to what many of my colleagues in Italy said, it's not possible, these kind of remedies are useless, they are only useful for some acute stuff and so on. And I had many colleagues really against me. I can tell you that still nowadays in my country, it should be bad to say I have many enemies, but my work is not appreciated at all, beyond the students that they have. All the others in our federations, they never wrote an article about my books in our official paper, just to give you an idea nowadays. So I think this is something. The chief of our community openly, in a couple of occasions, said in our Congress that I should kick it out of our society, so things like this. Today, I'm not talking about years ago. And so you can understand why I felt so down. Gianni Manotta became my best friend at that time because he was 10 years older than me. So I wanted to meet him and to follow one of his seminars. We started to talk. And when he discovered that I had so much material about cases so well taken, so well reported, with good results, he said, you don't have to give up on homeopathy at all. Please go on. Please go on. But I was almost close to saying, I have to change my profession and do something else along.
So the knack of doing, you are well known in our community for very in-depth case taking and very meticulous case records. So was it something that you were born with, or did Dr. Marotta had an effect on you, or somebody else?
No, Dr. Marotta was just encouraging me in doing this. That was something that I started to do from the very beginning, for a very simple reason, because I had the impression, reading our books, that there was a big contradiction in my opinion. On one hand, there was this beautiful work from the clinical material medicus, from the word of the patients, and I felt more than understandable that Kant had the idea of creating a repertory. At that time, nothing could be done better than this. But nowadays, if Kant was born now, he would never thought about a repertory, a book, because now with the good programs, you could have access directly to the sources, skipping this kind of bottleneck, which is the repertory. Please, I'm not blaming the repertory, which is a fundamental work for us, full stop. I just mean it was necessary at the time, they had to do this at the time in this way, but it has all the limitations that you know. So, which means sentences, real clear sentences, were scattered in pieces that are not so easy to repeat. I think that nowadays we waste a lot of time understanding, learning the code of the repertory in order to understand what this symptom means and what does it mean for this remedy and not this other. So I thought that the sentence, the words of the patients were much more precise and clear than anything else, as you can see in our daily work. So I said, why should I write down just the symptom instead of what the patient tell me? Because if I read my synthesis, if this case is not working, I repeat the same mistake. If I read what he told me, I said, oh, how silly I was that day. You know, I didn't understood what he clearly told me. So for that reason, I started to write everything. And I found out that the computer was much more useful. I'm talking about the 88, because it was, at the beginning, not faster, but easy to go back to your work if you keep track of this as a file instead of something written on paper. And so that was the story. And from that time up to now, I built on a treasure, for me a treasure.
Yes. So do you still feel that instead of having the fragmented... So do you still feel that instead of having the fragmented symptoms in our repertories, it is better to have the patient's language as a whole and then to look at it by searching in the computer?
Absolutely, yes. I think that this is a very problematic issue. Look, this is my idea. I'm not saying this because I am a fan of computers. I do believe that a computer is just like a screwdriver. It's better than a hammer. That's it. And a computer is a tool, just a tool. An interesting, useful tool, but it is just a tool. It's the homeopath who's doing the work. Full stop. Okay? Why don't we use this tool in a better way? So you have the impression that the repertory at the beginning was a way to allow us to use easier a very large number of symptoms from the materia medica. Okay? It was very handy. But I insist, nowadays we can do something better. Instead of imagining what this homeopath meant when he wrote something like this, instead of imagining what the prover meant when he said something like this, why don't we use the word of our patients, the sentences of our patients, which are much, much richer than what they can get in a few scattered words.
So we do have a repertory like Nerve's repertory on Herrick's guiding symptoms, which uses the prover's full symptoms instead of fragmenting them.
Yes, but let me say, without offending anybody, please, I have the impression that we started 30 years ago designing software for homeopathic purposes, which was a great step forward. I have the impression that in these 30 years, we were not really able to move forward. So at the end, if you really think about what happens in the great majority of cases, the great majority of our colleagues use the computer to repertorize faster. That's it. Okay, which is good, of course. I remember when I had to repertorize by hand, how difficult it was. But now with the computer, we have a science, we have a way of working that is based on the collection of experiences of many, many people, many colleagues and many patients. And those experiences has very little to do with what we do in official medicine. Because we don't study our patient through the amount of cholesterol, how many red cells you have in your blood, and the X-ray and so on and so on. We study our cases according to the manifestations, according to the representation of your disease, according to something which is not even our body. I call it the corpus, because the body, in my understanding, not my only my understanding, it is something that everybody person has. Our body is a very complex machine in some way that we can measure with high blood pressure and many other kind of things. But in the right moment that you make a proving, in the right moment you have a disease, a sickness, there is something that is not possible to be measured, that is our subjective experience of what we experience on ourselves. And this is not reported by signs, but by symptoms. The difference is that the symptom, it is always a very subjective experience, while the body is the objective experience. So collecting subjective experiences doesn't mean to collect the few data in a very reductive approach as you do in official science, which is good. If you have to make a cardiac surgery operation, if you don't have this data, you cannot work. But this is something else, which is different from what we do. We are interested in the subjectiveness, in the individuality of our patients. And you don't get this reducing your model of observation, but enlarging your model of observation. So the words, the story, this subjectiveness of this person does not come out from simple data. It comes out from complex data. And I think that from this purpose, the use of good programs is excellent. But we do need to make this step forward. Because if you present a program that works like this, very few people will do that. Okay.
So, for you, the subjective expression of the patient is important. But where does that fit in to the system? Because now there are two approaches. One is symptom-based and another approach is system-based. The symptom approach was always very objective. You take whatever the patient is saying and you just repertorize the symptoms and you try to reach a remedy. And now you have a system approach where you actually not start with just breaking down the symptoms, you try to figure out the system in which the patient belongs. Like you first think, okay, this fits into the lac remedies, now you come to which lac remedy it fits, which order it fits, and then which particular lac remedy does it fit. So where do you feel is...
I love this question. Okay, let me tell you what I think. I think that using a dualistic approach is one of the worst traps of our mind. So one of the reasons why I do love the theory of complexity is because you always work on a system where mind and body is not differentiated at all. You study a system where there is some expressions of the system to the mind, some expression of the system to the body, some expression to the system of the corpus, and many more things, not just these two. So, I think that provings, good clinical experiences, what at the end we call symptoms from our literature, if we can use a metaphor, is like creating a map. So at the end we say, Lycopodium. The map of Lycopodium is like giving a look to a town. Every remedy is a different town. Here there is the stadium, here the police station, here there is the train station, here is the hospital, here are the houses, here there is a park. Okay. When we study a remedy, more or less we design a map of something. The reality is the territory, is the town, it's the experience that you make when you visit Mumbai, not just give a look to the map of Mumbai. So, if you try to skip your question, thinking that the approach through symptoms is seeking the pieces of this map, a systemical approach is making the experience of visiting this town, and you need a map to know how you're moving through. But the map is not the territory. The symptoms are not the experience of the person. So I think that if those symptoms are well taken, they are driving us to understand, to feel better what the system is. Very often I think that many students, when they see a seminar of somebody talking about a systemic approach, not giving that importance to the so-called symptoms, it's because automatically this teacher, they have a background where these symptoms are already in. So they give you the impression that they're skipping this, but they know exactly what does it mean. It's not an approach that is directly systemic, it's an integration of this. So, I think that if we can move a little bit up and not considering this as a kind of duality, but considering this as two different aspects, apparently different aspects of the whole system, the problem is overcome.
I really like your example of seeing symptoms as a map and the whole system approach as an expression, overall expression, experience of the place. But where does the theory of complexity fit in, and how do you use that theory? Because a lot of people do not know what it is about. So can you elaborate it a bit?
Okay, so the theory of complexity by itself is always in official science recognized as the biggest step forward of the last century, the one which is just ended. So it's not a theory, it was a step forward. It's like the discovering of bacteria, it's like the discovering of light and the theory of gravity and things like this. So it's not just a theory, it's a step forward in human understanding. And it can be applied in different kind of fields. Also in medicine, also in psychology, also in homeopathy and so on. Complexity means that you, for example, skip this idea of duality. It means that you include something that can work as a duality, but it's not just this. It means that you put together different kind of pieces to try to understand something, what we call in science a fractal of our observation. There was a moment in science when many scientists thought that with scientific approach you can explain everything and demonstrate everything. Forget about. Complexity means that, I give you a very simple example again. You look to a leaf. It is a complex approach to recognize that from this leaf you can recognize the color, the shape, the nerves of this leaf, the weight. You can look here and there, the smell, how many things you can see. And these leaves belong to a tree. When we see a patient, when you try to discover something in science, when you study any subject, you will never have a total idea. I think that this is another big mistake of some homeopaths when they use the word totality. You see a complexity of symptoms, not the totality of symptoms. But what we can observe, a piece of this totality, is possible to be seen, to be studied, to be observed. It's possible to create a relationship with this leaf. So the more this leaf is seen from different perspectives, the more elaborated is our possible understanding of the tree. We will never get the tree. We can study better the leaf. So if the leaf is studied from a reductionist approach, like what we do very often in official science, mainly medicine. So we just say, okay, shape, weight, color, that's it. This is not a complex approach. If you consider that all these kind of things together are a possible description of the leaf that is bringing you to the tree, this is a complex approach.
And how do you use that in homeopathy?
I think that homeopathy was from the very beginning a complex approach. I think that Hahnemann said this very clearly. When even you read what Ehring said, we need a tripod. Of course, a tripod is a metaphor, because you cannot have a chair which stands on the floor with two legs. You need at least three. Okay, this is a metaphorical expression, which means it's not enough to know the pathology. It's not enough to have even a very good keynote symptom. You need to arrange an organization of our observation in order to try to create a picture. This is what we do. What I do in addition to that I think is more peculiar of my work, is to study our homeopathic literature. To study our homeopathic literature in an inclusive way, where together with this there is toxicology, there are the myths, there are the description of the substance, there are all the other possible way of studying the substance from different perspectives, which are giving more sense, which are giving more coherence to what we think a remedy is. Another step of this complexity is that I think that when you study a substance, you can understand a lot of how this substance is, which is not at all the theory of signature. It's a dynamic reading of what does every substance in order to be what it is. Okay? Why this plant lives in this way, why this other animal lives in this way to be what it is. And this is the expression. When you study a remedy, which is derived from this substance, there is a coherency between this remedy and this substance. When you study a patient, there is a coherency between the patient, the remedy, and the substance. So this possible coherence of at least 3 observations for me is mandatory. And this is what I try to do, of course, every time I study a remedy.
In the system approach, and we often see cases where correlation is often understood to be as causation. But in science, correlation doesn't mean causation.
Absolutely right.
But we see lots of cases where correlation is used to explain it and the cause for choosing the remedy.
Okay, you're right, and I think that this is wrong, or partially true. Let me say this. For example, in homeopathy, we have this well-known description of many remedies through ailments from, which is understandable. But in complexity, the idea of a relationship that is a causation is not that important. It's not seen in terms of something that produces something else and something that reacts that is like this. It's much more important to try to understand why, if this was a possible causation, you see this kind of reaction. Which kind of relationship does exist between a possible causation and this reaction, not the reaction produced that. Think about this in a more easier way. What do you think? We know, for example, that Ignazio Amara is so well known for a very difficult elaboration of griefs and loss. So what do you think? If you lose your mom, and Ignazio works, it means that you became Ignazio because of disappearance, or you were Ignazio before, and after making this experience, your Ignazio state came out so clearly out. I think that this is the question. So you're right. Many homeopaths think that because of this experience of the lost, you enter in a kind of Ignazio state and you need Ignazio. Which can be true on a simple level of analyzing cases. But you know better than me that if this should be true, any case of loss should be treated successfully with Ignazio. And this is not true. This is one of the worst experiences that we can have as human beings in our life. When Ignazio works, it works. When Ignazio doesn't, it doesn't. It is the same for arnica. It's not true that every patient who had a car accident improves with Ignazio. It depends on how you try to understand the law of similars. The law of similars is not an absolute concept, it's a relative concept. So if you use this in a relative concept, it's true that an animal, even a cat, if there is a car accident, reacts to a kind of trauma in a certain way. And this is typical of random inflammation and so on. Arnica can do some work in this direction. But I think that you observe in these cases that arnica can do something for a few days, but the difficult elaboration of this experience, if this is not an arnica case, stops. And so you think that you need another remedy after that. And this is how we can work. This is how many homeopaths work with decent success. I am personally much more interested in studying, when I can, patients to try to understand, okay, I can see that this is an arnica picture, and I should know that if there is an accident, this person could be severely decompensated more than many others. When you study a good arnica case, very often you don't see a significant accident that is producing a problem. You see a silly accident that in a certain moment of the life of this person became so threatening for this system. I was saying, you study a good case of Africa, if you have the time to take the entire story of this patient, of course, you can see that they did a lot of sports before. They did a lot of interesting, strong activities to demonstrate to themselves how strong, how Iron Man they are. But strangely, one day they could have just a stupid distortion, which is perceived as if now I'm getting old. Now this is really the beginning of the end of my capacity of being such a strong man as I was before. And I think it's much more important to recognize that this became a gigantic injury, much worse than the really big injury you had before when you were that strong, and this can be the beginning of something. Or if you have really a significant accident, it was so big that you were obliged to recognize the limitation of your system, the fragility of your system, and out of that you have to experience how life can be difficult in such a situation. But give a look, we have in Italy patients who had a tremendous car accident, even paraplegic, and they make competition of skiing at very high speed, and others that with a simple distortion don't move at all. So what there is inside that makes this situation be different. I'm interested in studying this, which not blaming, please, the prescription of handicap or bruises and injuries. Our students need to study from that. But again, if we are really interested in helping our patients to reach the highest purpose of their life, what do you think? What is really more important to be understood? For me, it's that.
And that makes perfect sense. That patient's experience is the second step after you've studied the symptoms and you've studied the whole complexity of the patient as a whole. But my concern is the way we are building our future tools, especially Materia Medica. You yourself have written some wonderful books on Materia Medica, on lac remedies, and many other plant remedies. And your editions are well known and are considered very authoritative and are being used by other homeopaths all over the world. And as you have told me earlier, to the whole audience rather here, that if you have a particular symptom in at least four verified cases of a particular remedy, only then you add it as an addition to that remedy. But we see a lot of Materia Medicas being written on the basis of correlation, not just verified symptoms which have been verified again and again and again. Rather, the students feel that when they read a lot of Materia Medica, that they have to understand the remedy on the basis of correlation. That, for example, any animal remedy, octopus is the remedy prepared from octopus gives this symptom because octopus behaves like this and this and this, or octopus has this ability to change colors and camouflage, so the patient also behaves like that. And similarly, for if the remedy is prepared from say lion's milk or sheep's milk, then sheeps have this kind of mentality, so we see this kind of symptoms in lacovinum. Because this is a very thin line, it's a subjective interpretation of how the animal is behaving. The animal is not thinking this way. It's our perception of how they are behaving.
Totally agree with you, completely. Let me say a couple of things, please. First of all, in my understanding, this is exactly what happened at the time of Hahnemann, when he so openly was that critical against the law of signature. But remember that the law of signature was fundamental for human beings to understand something that was very useful to help other people. At the time of Hahnemann, the human development in Western country moved more and more and more and more and more and more in the direction of a rationalization, of a clear rationality and understanding from a logical point of view, which was an important development. At that point, the concept of signature moved from something very serious to something very silly. Let me tell you this. It should be very interesting for us to understand why in our material medica, in medicine, there are so many plants, some minerals, some animal remedies, some fungi, known from our tradition that effectively are so useful. Think about digitalis, think about aspirin, think about riscum, think about taxus, and so on. So the question could be how that people for centuries were able to recognize that this substance was useful to help heart diseases without any chemical, biochemical, toxicological, scientific information. So that was the way of having medicinal products for centuries, for thousands of years. But a good example could be think about a movie or think about the photographs of this movie. Think about the entire interview or just, not even a clip, just a shot. If studying a substance in that way means thinking about what is our relationship between man and a sheep, it is absolutely stupid to say that a sheep is a silly animal and they move like that, and so for this reason, this is what you do with the remedy. This is exactly my understanding what Ariman said, no, no, no. You have to prove the remedy, you have to understand what's going on. Eventually, certain aspects of how this animal used in terms of strategy to be what it is and not a goat can be interesting to give more understanding, a better understanding to our provings. But I personally don't think at all that our silly lecturing, our silly reading, our silly basic observation like this can be helpful in homeopathy. I am completely against that, totally against that. I think that for me it's interesting to study some aspect of the behavior of a plant. This is used now in science to study the sociability of plants. Why a certain kind of plant like Salix albus, willow, grows so well close to the water that out of this bark you can extract something so useful for certain kind of rheumatic disease. And they made aspirin out of that. It took some decades to understand that aspirin works on prostaglandin and many other things, and we can give now a kind of scientific explanation of this. Before it was not known at all, and it worked anyway. So I don't think it's this instead of that. I think that the complexity of the observation is not like to say a red plant is good for blood, a yellow plant is good for gallbladder. This is stupidity. It's like to say, you say that sheep are stupid and we give it for silly people, and lions are great and we use this for strong men. Forget about. Also because it's not even true. If you talk about lac leoninum, you have a pretended strength, but it is still milk. And somebody that would like to appear like this, there is nothing to do with the person who is really strong. So I think it can be useful, again, in terms of complexity, if you study a certain substance, to try to understand that this substance, not in terms of a shot, but in terms of a moving, of a dynamic, of a complex system, and to try to understand it dynamically, which kind of strategy, survival, this plant, this mineral, this animal uses in order to be what it is. This can be helpful in my understanding to remember better, to try to have a better idea of the case. It's not the explanation why, because of the behavior of the lion, this is a lion remedy. Forget about it. This is not at all what I ever said in my life and what I think at all.
And that makes a lot of sense. But another thing that I would like you to elaborate is that your work is known to have a lot of system approach, and the theory of complexity is also very holistic approach when you look at the patient as a whole. The sensation method also has a lot of system approach built into it. How does your work related to the theory of complexity and the work on the different systems that you have done, the animal remedies, the plant remedies, the different groups, how is it similar and how is it different from the work related to the sensation method or the work of Jan Scholten or the kind of remedy groups that have been generalized and then you distill to a particular remedy? So how does your work fit into that kind of work? Is it similar or how different is it from that?
I think that in the last 30 years, we started a revolution in homeopathy, which probably never existed so deep, so strong, so all over the world, with so many different kind of contributes to our science. And I'm not saying this to be polite, I do believe this. I think that the work of Rajan, the work of Jan, were different ways of exploring the same kind of things and giving a possible explanation and classifications to our remedies from different kind of perspectives. It is normal that if you move from studying and using not more than 50, 60 remedies, and you start all of a sudden to a larger perspective, to so many more, you have to find out a way to create a kind of homeopathic taxonomy. Let's call it like this. It's mandatory. Otherwise, you get so frightened by these huge mountains of remedies that it's not possible even to start to work. Okay? And I think it's good. Taxonomy and systematization and trying to put remedies in different kind of boxes is the only possible way to face this huge number of substances. Please, I'm not saying this to reduce the huge work done by Jan, by me, by Jean-Michel, and many others. I mean that from a very logical perspective, watching this one upside down, it was needed to find out a kind of homeopathic taxonomy. And again, like in taxonomy, we see we have different ways of classifying nature from the taxonomical point of view. We have at the moment 8-9 different taxonomy for plants, and we have more or less the same for animals. Again, the mistake is to think that one taxonomy is better than the other. Taxonomy are against perspectives. So you can study plants according to their biochemical compounds, to the main alkaloids, to how this plant used to live and which other kind of plants live together with that. You can study plants according to the flower, as Linnaeus did, and many other things. It's not true that one of these is better than the other. One of these is perspective according to the definition of this model and following this model. At the end, when Jan, which I know very well, when Raja, when we meet and discuss these kind of things, at the end when you see them taking a case, me taking a case, Raja taking a case, we do the same. At the end it's important to try to understand try to make this person suffer more, and we arrive to that from different perspectives. I think the students are the ones that can look confused, because it seems as if we're saying three different complete things. But this is absolutely normal in science, in philosophy, whenever you study something which is complex and not that simple. So I think that you are a good experienced homeopath. That homeopathy can be used practically in different ways, and it works. So I think each one of us should follow which kind of approach fits better to his way of thinking, his way of living, his way of understanding, to what gives more pleasure, working like this instead of this other. Why not? So what is important in my understanding for a model of thinking for us as homeopath is, first, it has to work. You have to see real good results, full stop, otherwise it's a fake. Second, it has to satisfy you as a doctor, because believe me, if I should work as other colleagues used to do, I would not find any pleasure in doing that, because it's not intriguing for me. So as I respect the individuality of my patients, we should respect ours. And each one of us is singing, playing, and practicing our work in a different way. Third, I think that a good model should provide something that makes our science grow and develop and give more understanding. So if we respect these three issues, effectiveness, the pleasure of doing this, and contribute to the evolution of our science, each one of this is extremely good. And you choose what fits you better.
Yes, and that makes me to the next topic. We've already discussed the clinical aspects, the education aspect. In 1993, you started ULMS, the Association for Homeopathic Research and Study. How did that come about?
It came about because, of course, if you have the impression that you're starting to develop something really original, I hope you don't take it as too much bombastic. There is something which is really original in my work. I felt that it was necessary to share this experience with my other colleagues. So we needed an association which was a no-profit one, which was able to arrange our seminars and our studies and our investigations. And so each one of us in the end is doing something like this.
But with the kind of environment that we are facing internationally today, and homeopathic schools are going down, the number of students are coming down, what future do you think that there has been some kind of collective mistake in the way we have promoted homeopathy or worked on homeopathic education? Why do you see there is a global decline in majority of the countries, Western countries, especially outside India, for homeopathy education?
You are touching a very weak point that make me suffer and concern a lot, and on which I'm trying to give my best possible contribution. Again, it's not because I love complexity. I think that this is a complex problem, and I don't know if I knew all the components of this, and at least I think we should consider a few of these which are very important. First of all, this revolution, as many revolutions, in the moment that it does exist, could give a kind of impression of something chaotic. Every revolution process has this side effect. So it was easier 30 years ago to study homeopathy than today, even if there were many disputes at the time of Animal 2. So homeopathy was like this since ever. Now it is more than this. It's much more complicated. I think a big part of that is because, let me say this openly. In Europe, until a few years ago, there were several homeopathic pharmacies doing an excellent work. Little by little, the commercial side of this made a big company role, destroying the possibility of working on the others, and becoming a kind of leader of homeopathic remedies in the world, at least in the Western countries. They had even to invent a kind of way of practicing homeopathy that was functional to the prescription of these remedies done in this way, thought in this way, and not functional to the development of a serious homeopathy. Which makes sense, because homeopathy was never designed to be something commercial. If you give one little globule and a patient is reacting 1 month, commercially speaking, it's a disaster. Okay. In the right moment that you enter in the market, you need to sell tubes and to say to your patients, use many of these globally every day, many times a day, and you have to take many remedies all together to see some results, because it's important to sell. Okay. And if it's important to sell, you need to create schools that should provide this kind of education. I would like to call it education because it is a diseducation. Okay. Let me say this very openly. The result of it, after 15 years, was a disaster. Because at the beginning, many colleagues tried to follow this kind of diseducation, and the result was that the greatest majority of them never continued to practice homeopathy, never used successfully that. A big mistake, from our point of view as homeopaths, as what I consider serious classical homeopaths, was to keep our eyes closed, not to be smart enough to understand what could have been the future of this, and to allow this process to go on without protesting. So now it's very difficult, because in many countries, Italy is one of this. When a typical journalist makes an interview or make an investigation, they can easily say, paid by the pharmaceutical companies, which is another problem, that in Italy you have 7,000 homeopaths, which means 7,000 people declaring that they are something like this and prescribing whatever instead of allopathic medicines. The truth is that from these 7,000, there are not even 300 that are working, and probably 60 doing a very serious work. This is what is happening all over Europe. And because of that, the results are extremely poor. What is interesting is that slowly, even if we have many enemies in allopathic medicine, I can tell you that since I started to work up to now, the number of doctors, conventional doctors, and the families of these conventional doctors, the good friends of these conventional doctors, are more and more and more and more. From that time on, up to now, there are many more patients who understood what does it mean a serious homeopathic treatment, what does it mean a kind of complex approach, what does it mean not only to be treated naturally, that could mean nothing, but to do a serious path with a good homeopathic doctor to try to face their sufferings from a different perspective and with good results. It is interesting that the greatest demand in Europe is for very serious pathology, while this kind of pharmaceutical companies would like to sell homeopathic medicine for common diseases because you sell it in pharmacies. You know, in France and in Italy, this is important to be understood for you. We are not even allowed to give our medicines to our patients as you do. I have always to send my client to an apotheke, a pharmacy, to buy it, which means, you know, someone else, not just me and the patient, who is in between with all the commercial interests of that, which is a big, big, big issue. So I don't like to blame always what is outside, because of course we are under a big attack from the big pharma, because we are threatening their position, because it's so successful. But I think that inside of us, internally, in our community, we make many mistakes that need to be adjusted. hoping it will be possible.
So what is the way forward?
I think that this cycle, this up and down happens. It happened in homeopathy more than once. Probably this is a kind of decaying period, and this is another moment, another important issue, I think. What I see, not only in Italy, what I see, because I often go to teaching university, in allopathic university, to try to explain what homeopathy is. What I see now is that the mode of medicine is dramatically changed, the conventional medicine. And the interest for the complexity of the patient, for the story of the patient, is decreasing. What in Western countries we call a defensive medicine is mainly the concern that if I treat you, I should not see bad results because of me. So if there is a protocol, I respect this protocol. If the treatment doesn't work, it's not my fault. And medicine is moving a lot in this direction. Homeopathy is the opposite, because it's not recognized, and because by definition, every single case is different. You cannot have a homeopathic protocol, even if someone does, but it's not what homeopathy does usually. And so from that perspective, I think that the mood, the way of thinking about sickness and diseases is in some way forced by Big Pharma and by a certain way of thinking to follow the direction of this decline of medicine. Decline in terms not of technology, because from the technological point of view, allopathic medicine made gigantic step forward, fortunately. But in terms of their epistemology, in terms of their theory, in terms of their approach to diseases, it did not change at all, it's getting worse. So we are a big enemy from that perspective. We are not organized, we are not underlining our good work, we are not clearly saying, I know in my reality in Western countries, that those kind of things has nothing to do with homeopathy. Probably we have to face this moment of crisis, and I think it will rise up in 10, 15 years.
You already have nearly 35 years of homeopathy behind you, and you have achieved a lot of cured cases, a lot of books, a lot of original work that you've contributed to homeopathy. In your personal sphere, in your personal zone, what is your concern for the future? What kind of work do you see yourself doing in the future?
What I would like to do?
Yes. What is your focus now? After having already done so much?
My focus now is to do my best, possibly to leave the most of my experience, because what I'm trying to write is not even 10% of what I did. And it's a pity, because I would like to leave this kind of a little heritage from what I can see daily in my work. I still see many patients every day, and I enjoy that. Another little dream that I had, I like to confess this to you. I had some experiences treating people in jail, which was great, not only from the human point of view, but also from a very egoistical point of view as a doctor and as an homeopathic doctor. I tell you what I mean. We did brewings with nice people. We treat patients that are not coming from this kind of environment. We have pictures of our remedy based, as at the time of Freud, on a kind of middle class people with a certain way of thinking and living that are giving us a certain kind of model of certain remedies. Think about it. If you go to a big jail with some hundreds of prisoners, Do you think they are all cases of mercury or tuberculosis? No way. There are surely many cases of pulsatilla, harmonica, and remedies like this. So I think that we miss a lot in our materia medica, not the dark side, but a more extensive understanding of how our remedies could be in kind of extreme situations. I think that this could really improve our understanding, not only be a great human experience helping people in this kind of difficulties, but really improving in a very egoistical way our knowledges about remedies. Because I think that only a certain kind of spot is a little bit known. We should investigate much more. And I think that a good experience in vet medicine, studying seriously animals, can tell us so much what is really precise and what works, in a more extensive way. I'm hoping to be able to do something of this.
This sounds so very exciting, and it would be so useful to have that kind of dimensional understanding of our remedies. And I really wish good luck to you for that.
I hope so.
Dr. Massimo, it has been an honor, it has been a pleasure to have this conversation with you, and I really feel grateful for giving me so much of your time.
Thank you so much. It was a pleasure for me.
Yes, so thank you so much for this conversation.
Grazie. Grazie.
Thank you.
Grazie.